a patient is diagnosed with cancer, ultimately their safety and health comes first. So if they need to go into treatment immediately, of course, that takes precedence. However, for many patients, there's a couple of week lag between getting diagnosed and starting treatment with chemotherapy or radiation. During that several weeks time is when we can actually get either egg, embryo, or sperm freezing in. I like to speak directly with their oncologist to let them know what medications I give, what the risks are, and what the timelines are. So that way, and additionally speak with them about, how soon does this person need to start treatment, or how long can we hold it off? So that way we together can come up with a plan that addresses the patient's, desires to have a family in the future, while also keeping their treatment for their cancer top of mind. Females who are reproductive age who are diagnosed with cancer have several options. So whether you're single or coupled, we can talk about the pros and cons of egg or embryo freezing. And even single females may choose to freeze embryos with donor sperm. A lot of this depends on your age, the specific cancer diagnosis, and sort of what your plans are for the future. For men, sperm freezing takes a lot less time, but they are able to come here and freeze their sperm, and they can freeze several times often prior to starting their treatment for their cancer. I think a lot of times people think of our office as a women-only office, but we see men too, and we're happy to help them preserve their fertility so they can have children in the future. If you're the parent of an adolescent or child who's been diagnosed with cancer, we can also talk to you about your options. Often, even in adolescence, we can do egg freezing and sperm freezing, and if you're on that borderline that you haven't gone through puberty yet, we can at least talk to you about options that may be available to you in the future, so that way at least you're informed prior to undergoing treatment. A lot of patients are worried about how long are their eggs or sperm good for, and fortunately once they're frozen in time. And we have great facilities here that can keep your eggs, embryos, or sperm frozen safely for a very long time, and it's ready for you when you're ready to use it.